What if your loved one isn't just getting older? What if those small moments, forgetting a familiar name, asking the same question again, or getting lost on a route they've driven for years, are actually early warning signs of something much more serious? Many families dismiss these changes as a normal part of aging. They laugh them off or say, everyone becomes forgetful with age. But here's the truth. Normal aging and Alzheimer's are not the same thing. The earlier Alzheimer's is recognized, the sooner a person can receive medical evaluation, plan for the future, and benefit from treatments and support that may help manage symptoms. In today's video, we'll reveal 10 early signs of Alzheimer's that many families miss, explain why they matter, and discuss when it's time to seek medical advice. Stay with us until the end, because the final sign is often overlooked, even by close family members. 1. Memory loss that disrupts daily life. Everyone forgets things occasionally. You might walk into a room and forget why you went there, or misplace your keys. That's normal. But Alzheimer's-related memory loss is different. A person may forget important dates repeatedly, ask the same question several times within minutes, depend more and more on notes or family members, forget conversations they had earlier the same day. For example, imagine a mother asking, "What time are we leaving?" 5 minutes later, she asks exactly the same question and has no memory of asking it before. This pattern is not just ordinary forgetfulness. 2. Difficulty planning or solving problems. Another early warning sign is struggling with tasks that once felt easy. Someone who always managed household bills may suddenly become confused by simple numbers. They might forget to pay bills, have trouble following a recipe, lose track while balancing a checkbook, take much longer to complete familiar tasks. These changes can affect independence long before memory problems become obvious. 3. Trouble completing familiar tasks. Many people with early Alzheimer's begin having difficulty with activities they've done for years. They may forget how to operate the TV remote, need help making tea or coffee, become confused while driving to familiar places, forget the steps of a favorite hobby. These aren't new skills, they're everyday routines that suddenly become difficult. 4. Confusion about time or place. Have you ever forgotten what day it is? Most people have. But with Alzheimer's, confusion goes much further. A person may forget what month or season it is, believe they're living in a different year, become confused about where they are, get lost in familiar neighborhoods. Imagine going to the grocery store you visited for 20 years and suddenly not knowing how to get home. That isn't a normal part of aging. 5. Difficulty understanding visual information. Many people don't realize that Alzheimer's can also affect vision. Not eyesight itself, but how the brain interprets what the eyes see. Someone may have trouble judging distances, recognizing faces, reading words, identifying colors or contrasts. This can increase the risk of falls or driving accidents. 6. Problems finding the right words. Have you ever forgotten a word? That happens to everyone. But Alzheimer's makes language problems much more noticeable. A person may stop in the middle of a sentence, repeat the same stories, use unusual words for familiar objects, struggle to follow conversations. Instead of saying watch, they might say the thing that tells time. 7. Poor judgment and decision-making. Changes in judgment can appear surprisingly early. Someone may give large amounts of money to scammers, ignore personal hygiene, wear winter clothes on a hot day, make unsafe financial decisions. Family members often mistake these behaviors for simple carelessness, but they may be an important warning sign. 8. Personality or mood changes. Perhaps the hardest changes for families are emotional ones. A normally calm and friendly person may suddenly become anxious, suspicious, irritable, easily upset, withdrawn from family gatherings. These mood changes aren't always caused by Alzheimer's, but they deserve attention, especially when they appear alongside memory or thinking problems. 9. When should you see a doctor? Experiencing one of these signs doesn't automatically mean someone has Alzheimer's. Other conditions, such as medication side effects, vitamin deficiencies, thyroid disorders, depression, or infections, can also affect memory and thinking. That's why it's important not to diagnose yourself or a loved one based on symptoms alone. If these changes are persistent, worsening, or interfering with daily life, schedule an appointment with a qualified healthcare professional for a proper evaluation. Conclusion: Alzheimer's often begins with small changes that are easy to overlook. Recognizing these warning signs early can help families seek medical advice sooner, access support, and plan ahead. If you found this video helpful, please like, subscribe, and share it with your family and friends. It could encourage someone to recognize symptoms early and seek the care they need. Remember, growing older is normal.